And then I think if you guys hit panelists or participants, you should be able to see on the right-hand side. Okay.
Yeah, right now we're talking to ourselves. They'll start to come in. Oh no, there's attendees. There we go. Welcome to those that are just joining us. We're still waiting for other attendees to join, so we'll get started shortly. For those that are joining us, if you want to add to the chat function where you're joining us from, we love to see where attendees are coming from. So feel free to put your company name or business in the chat. So for those that are just joining us, we're just waiting for a couple more people to join us, looking at our participants and those that have registered, trying to give people a couple more minutes to get on board. We appreciate you being here today for our speaker series of 2020, talking about health equity. We have a very dynamic panel. We'll get started in a few minutes. If you just joined us, feel free to put your company, business, or name where you're joining us from in the chat. We love to see where everybody is from. And if you're on the phone, welcome to the callers that called in. All right, I'm going to go ahead and get started. I think we're going to have to do some background music in the background, because I think for those on the phone, there's just lots of dead noise. So we are here, and this is our speaker series 2020, and our topic today is health equity, and we are so happy that you could all join us. So as people continue to join us, please feel free to put your name and company in the chat. We love to see where everybody is coming from. Today, I wanted to thank first our sponsors for today's event: Maryland Hospital Association, Tribridge Partners, CareFirst BlueCross BlueShield, and in partnership with the Greater Baltimore Committee. So thank you so much for your sponsorship and your partnership today. So Jordan Sasanya is on our panel. She is our manager of communications and marketing manager and business development. So you will see her. She's usually behind the scenes, although I told her to keep her camera on, so she can get used to being on webinars like everyone else. So we are super excited to have you here today to talk about a very important topic, which is a very broad topic, and we're going to narrow it down for you a little bit. And we encourage you as well to ask questions throughout the next hour to make it a more robust conversation, obviously. So I'm going to start with just an introduction for each panelist. And we'll start off, I'm going to go right over to Ruth Williams-Brinkley. Make sure you take off the mute. It's the #1 rule of a webinar.
How's that?
That's beautiful, Ruth. Welcome.
Good afternoon. Thank you. I am Ruth Williams-Brinkley. I am the president for Kaiser Permanente Mid-Atlantic. I have been with Kaiser Permanente about 3 years. Prior to that, I spent my career in hospitals. I'm a registered nurse by background, and I've spent my entire career in healthcare. I want to say that it's being in healthcare and being in healthcare at a time like this has been it's been, I wouldn't say it's been, but what I would say is that I felt called to be in healthcare at a time like this. There's so much going on, and there is so much need. And I just want to give a shout out to all those who are working as first responders, frontline workers, including our healthcare workers. We need all of you. We appreciate all of you. And we thank you for everything you're doing. Thanks.
Thanks, Ruth. And I think a big piece of today's discussion will be around those frontline workers, staff, and so we will we will get to that piece of it. So very important that you highlighted those workers. So thank you so much for being here today. I'm also going to turn it over to Angela Celestin from CareFirst to introduce herself.
Yes, thank you. I'm Angela Celestin. I joined CareFirst about a year ago now, and I'm happy to say that I'm a part of the CareFirst family. I am the Chief Human Resources Officer at the organization, and CareFirst remains committed to health equity. Our mission is to improve health outcomes, increase access and affordability, and safety and quality of healthcare throughout this region. So I'm very happy to be here. I'm responsible for shaping the employee experience here at CareFirst. My focus has been on building talent capability, and really driving what I'd like to call robust and progressive HR practices throughout this organization. So I'm happy to report that we have a few initiatives going on right now, including shaping our equity strategy in partnership with our health services team, both inside and outside of the organization. But today we're going to be focusing a lot, I'm going to be focusing a lot on what we're doing internally within our organization, such as starting Equity Council late last year to really focusing our training, recent training for our leaders on things like empathy and resilience, and just, helping them anticipate the needs of our employees during this tough period. So very happy to be here.
Thank you, Angela. And you bring up very interesting topics as well. And again, the lens of our webinar participants and our panelists are all very different. So we'll have to narrow that down a little bit for everybody. And I'm going to transition it over to Andy Attman, who's joined.
Hello, everybody. Andy Attman, Vice President for Acme Paper. We're a third-generation family-owned business that my grandfather started in 1946. And my main role is on the sales side, but being part of the family that owns the company, understanding the health and wellness of our employees is really important to me, because having them be healthy, both mentally and physically, is really a big part of having them being able to produce on a daily basis and be happy while doing it at the same time. From a sales side, we work with a lot of the healthcare institutions in the Mid-Atlantic, a lot of the hospitals, a lot of the folks that are on the panel, as well as just a lot of you joining us today. So I thank you for the business. And what we've been doing during these times of COVID is really taking that healthcare expertise and trying to teach that and educate those that don't necessarily know the proper practices of disinfecting and proper hygiene, and educating them so that they can create a workplace that is healthy for their employees and their visitors as well.
Thanks, Andy, for joining us. And we're really excited to have a business perspective and lens for today's discussion. So thank you. I'm going to transition it over to Dr. Michelle Gourdine.
Good afternoon, everybody. I'm Michelle Gourdine. Currently serve as Senior Vice President and Interim Chief Medical Officer for the University of Maryland Medical System. Our system is comprised of 12 hospitals, over 150 locations, and 28,000 employees providing healthcare, 25% of all healthcare in the state of Maryland. So we have a mandate to ensure that our citizens are safe and healthy. And it's been absolutely a privilege to be a part of this team for almost 3 years. I want to echo the comments that were made by earlier panelists, expressing my gratitude to all of our healthcare workers, our frontline workers who were right in the midst and in the throes of all of the work that was done dealing with COVID, a novel virus that no one knew anything about, but still in there saving lives every single day. And it's been a privilege to work alongside every one of them. I'm a pediatrician by training, and actually spent about 13 years of my career in public health. And so health equity is important to me, not only from that standpoint, but also from the standpoint of where I grew up. I grew up in Jackson, Mississippi, the daughter of a school teacher and a civil rights attorney in the 60s, 70s, and 80s. So you can imagine all of the things that I have experienced, but I can say that my upbringing was grounded in fairness and justice and equity. And so that is why this topic is so important to me. So Tracy, and to you and HCAM, thank you for the invitation.
Thank you, Dr. Gourdine. We've known each other a long time in your previous work at the Department of Health, and so we are happy to have you here, your expertise, your lens, and the work that you're doing, not only and I'm going to turn it over to Cara James, who I've also known a long time, previous HCAM board member.
Thank you, Tracy. Good afternoon, and I see that we have at least one person from Arizona, so good morning, and over there. It's my pleasure to be here, and I also want to thank HCAM for putting together this really important conversation. My name is Cara, President and CEO of Grantmakers in Health, and we are an organization that works with health philanthropy organizations, including about 240 philanthropy, corporate giving programs, and philanthropy serving organizations, all focused on health, and we work across a variety of areas. I've been at Grantmakers in Health for 6 months, and before that was at the U.S. Services, where I was the director of the Office of Minority Health at the Centers for Medicare and Medicaid Services. So this topic is near and dear to my heart. It's been where I much of my career and as a researcher, including racial ethnic minorities, people with disabilities, and rural communities. So really excited for the conversation and looking forward to the topic today.
Thank you, everyone. And I guess I should introduce myself. Tracy Kodak. I'm the CEO of Healthcare Access Maryland. I've been with the organization 20 years and CEO for 4. Moderator, and I lead this panel to guide the conversation, to answer some hard questions, to ask some hard questions. And I'm really excited to break down a little bit and peel back the onion on health equity. I think it's a very large topic, and we probably could be here for days and weeks to continue the conversation. I do want to remind everyone on this webinar format, so we just get to talk to you and we can't see you, but we can see all your names, and thank you for putting in the chat where you're from. We're excited that our reach is far across the state of Maryland and all the way out to Tucson, Arizona, and Phoenix, Arizona, one of our board members joining us. So thank you so much. So we're going to jump right in. And if you have questions as we go along, please feel free to put them in the chat. We'll leave time at the end for Q&A as well, but if there's a topic or a specific area that you want to ask a question, please feel free to do that. And I think Jordan can also unmute a participant for asking those questions. So we're going to first define equity from a specific lens. It's very broad. So we want to make sure that we're on the same page today on how we're defining health equity. And I'm going to turn that over to Dr. Gourdine first.
So Tracy, you're right. Health equity is a very broad topic, but my attempt to define it would be to say the following. What we're talking about when we say health equity is making sure that every single person has a fair and just opportunity to have good health. And one might wonder, well, you know, don't we all have that fair opportunity? But in actuality, we understand that there are various obstacles that prevent people from being able to be healthy, not only relative to access to medical care, but also social factors that relate to the environment in which one lives and works and plays, the economic stance of individuals, their access to health care, their access to healthy food and transportation, issues related to education, and employment. We still have a significant number of citizens in this country who receive health insurance through their employers. And so if they are not employed in jobs that provide that insurance, that hinders their access to health care as well. And then we also understand the psychological toll that individuals face in dealing with discrimination on a day-to-day basis. And that also can manifest itself physically as well. So again, the fair and just opportunity to be healthy is how I define health equity. And what I'll end with saying is that health equity is not about treating people the same, it's about treating people fairly.
Thank you. Cara, did you want to add from your perspective anything?
Yeah, I think I agree with everything that Dr. Gourdine said, and I think the only things that I would add and emphasize is that health equity is a journey. It's a destination of where we're going to get to. It's a work in progress. So we get there when everyone has achieved their highest level of health, and as Dr. Gourdine said, that people have that opportunity to reach those goals, and we've removed those barriers. So it doesn't mean that we're treating everyone the same, but we are giving people what they need to be able to achieve that highest level of health. And one way to sort of think about that, there are a couple of images that people use when they talk about health equity. One, some of you may have seen, is sort of people behind a fence at a baseball game, and they're different heights. And so if you give everyone the same box to stand on, it doesn't necessarily mean they're all going to be able to see the game. But if you give individuals the box that they need to all achieve that level, then that's a little bit more of what we're thinking about. So how do we help people get what they need to be able to achieve their highest level of health by removing those barriers that they are faced with each day?
Yeah, I've had that that visual before, and I would have loved to have been able to grab it. I might be able to grab it while we're having some conversations. It's a fantastic visual, the difference between those two. So thank you for that. Now, this is one of the biggest pieces of this conversation today is around businesses, and we want to make sure we're jumping right into the meat of it. And why is it important for businesses across Maryland to care about health equity? I mean, that's a really valid question, and one that we want to dig into a little deeper. So anyone want to start off with that one?
I'll go. So it's important because there's a couple aspects of it, especially in the world of COVID. Health equity is important because you get to a point where you want to be able to provide to your employees so that they're happy coming to work. In the world of COVID, it makes it a lot harder because we have a lot of workers that are remote. And so there's a lot of outreach and on our side at our company that we're constantly trying to stay in touch. And I've been having a lot of conversations internally with folks in my office recently about it's more than physical. I really think mental is a huge piece of what's going on today. Because people are separated from their normal work life, and a lot of their socialization is no longer there. So it's trying to find some of those other aspects to make sure that your employees are happy and healthy, and make sure that you're staying in touch as a manager with them, or even a coworker, and just touching base to see what they're doing. And from our world, I think that's a big piece. It also talks about, to me, is on the recruitment side. That if we can talk about what we're able to provide to our employees of all types, whether for me, it's warehouse drivers to internal office, accounting, customer service, or sales, I think being able to put together a package that's good for everybody. And again, like Cara said, it's not everyone needs the same thing. And so being able to put packages that work for them to make them get to a more even playing field, I think is a very important aspect of the recruitment for world.
You know, Tracy, I would add that I would agree, first of all, with what's been said. What I would add is that our employees are struggling right now, and businesses will not be successful if our employees don't have a balance, at least as much balance as we can get right now in terms of their lives. We believe, you know, I would say at our company, at Kaiser Permanente, we sort of have a simple definition is that people need what they need to pursue the American dream of happiness, of life, liberty, and that pursuit of happiness. And when employees are healthy and they have the psychological balance they need as well as the physical balance, they are able to contribute more. They're able to help our businesses to grow. You know, we're in a very just an odd time right now. We won't always be here. Now, no one knows when we'll come out of it, but we won't, I do believe we won't always be here. We need to be thinking about how do we nurture our employees and support our employees through this time so that when this period does end, they're able to help us and our businesses be successful, and more importantly, our communities. Because our businesses and our employees all exist within families and within communities. So it's in all of our best interests to make sure that there is a healthy ecosystem that surrounds our employees and the communities and the businesses.
Thank you, Ruth. I know, Angela, you had mentioned briefly about some of the things that CareFirst is doing from a business perspective for your employees. Do you want to talk a little bit about that?
I'll first start by stating the obvious, that health equity, it's the right thing to do in order for us to truly be good stewards of our members' dollars. We need to address all social determinants of health. Health equity not only saves money, it saves lives. And so it's just one of the ways that we build a more just society. A society that tackles racial disparities really head on. And so it's extremely important at CareFirst that we address health equity. And we've been following the Institute for Healthcare Improvement competency model. And it gives guidance on kind of how companies should make health equity a strategic priority. And that's pretty much what we've been doing, making this a strategic priority. It's a way to eliminate racism. It's a way for us to partner with stakeholders to promote health and health equity within our communities. And we're noticing that if we don't address it, that's a real problem for us. You lose the lack of trust in the company, our company. We must remain that trusted partner within our communities in order for us to affect change. So it's important not just for the members of our communities, but for the trajectory of our organization. And if members can't trust us, they won't stay with us. And I would say the same with our workforce. Employees are increasingly more looking for values in companies before they choose to work for a company. What are our values? What do we believe in? What do we stand for? And so I think it's also a way for us to attract the right type of employees. And employees are holding us to a higher standard these days, addressing not just professional needs, but personal needs as well as social needs of our environment. So.
And just one last point I would add that agrees with everything that's been said. And I think building a little bit on some of what was just said, the other thing is not only are employees looking for value, but investors are also looking at values. And we're seeing a growth in socially conscious investing and people who are really looking at what are the companies that they're investing in, expressing value. And so it helps in that respect as well for companies to focus on health equity, in addition to obviously caring about the people who are working for them. We all, as managers, care about our employees and their families, but helps with productivity. And I would just add the ability to attract other investors as well.
Thank you, Cara. Angela, we had a question, the name of the model for health equity. Either you can let me know and I can type it in the chat, or
the Institute for Healthcare Improvement, IHI.
Okay, thank you. Great resource. And I wanted to share, one of our panelists actually shared the visual. So hopefully everyone can see that. That Cara James was referencing earlier about equality versus equity, where everyone gets the support they need. This is the concept of what was affirmative action, that thus producing equity, and then justice, where all three can see the game without support and accommodations because the cause of the inequity is addressed. The barrier was removed, right? The fence was removed, where we all have an equal view of the field. So I like this one especially. I've seen the other one where it's just the two, equality and equity, and we'll put that in the chat for you as well if you'd like to share that with your team members. So thank you for that, Cara. I'm glad, and thank you to Kimberly Prescott for sharing that with us. what are some of the consequences if employers are not paying attention to health equity? I think this is flipping it a little bit, and some of the consequences of not paying attention.
So I'll take a stab at it, Tracy. Obviously, a couple of things. If you're not paying attention to health equity, you're not acknowledging sort of the no-brainer in the room, which is when we talk about addressing health equity in our communities, much of our workforce comes from our communities. So they're one and the same. And so in not paying attention to health equity, in perpetuating by default health inequities, you affect not only the well-being of your workforce and their family members, but also their productivity, their ability to be present at work and to work well and do work that they're proud of. We also run the risk of talking a good game but not backing it up, right? So if we're talking about health equity, we're asking our workforce to promote health equity, but we're not paying attention to them and ensuring their equity, then there's an imbalance and there's a mismatch there. So I think in terms of our integrity and in terms of our caring about our workforce and acknowledging that they are members of our community, it's important for us to talk about and to address it.
And I would add, Tracy, that you don't, and I want to amplify what Michelle said, you don't get the very best from your employees when there is not equity. People can see it, they may not discuss it, but it's the elephant in the room, and people talk about it in quiet tones, and you spend a lot of productivity dealing with the unspoken elephants in the room rather than what needs to be addressed. And I think if we want our businesses to be successful and to just be the best that they can be, we have to have the best employees, and they can only be their best when we give them that opportunity to have equity and justice. So they just run hand in hand. You can't have one without the other.
And it is really, oh, go ahead, Andy. Go ahead.
I was going to say, I'd add one other piece to that. Everything, I agree with both Michelle and Ruth. The other piece too is attendance. Is you're more apt, if you don't have that piece, for people just to be, call out and just sit there and say, hey, you know what? I'm not going to work today. I don't feel, it doesn't feel right, or, I just don't care. So
Right.
they're not getting the care from the employer or their managers and their team. Then you also have that. So I think, and that it's one thing to have an employee show up to work and not work at their fullest and their most capable, but it's also another point to not have them show up. And then the other effect of that is now you're affecting all the other employees in the company because they have to pick up the slack for that person who didn't show up to work today. A lot of times it's justified, but in other times where you have those marginal choices, and someone will sit there and say, nah, I'm not going to come to work today. And it's because of.
And I would add one last thing is that health disparities cost our society a lot of money. There have been estimates that it's as much as $224 billion. And for employers who are providing health insurance to their employees, those costs come out in the healthcare system from people who have poorly managed diabetes or disparities in diabetes or any of the other hypertension or any other chronic conditions that people are dealing with. So there's a real economic toll that is borne by all of us, but also borne by those employers. And I think not addressing that can lead to increased financial costs to the employers.
Absolutely. You all bring up such amazing points. And I think, as 20 is such a odd year, I feel like it's the 1999 year, the Y2K that never happened. For those that can remember Y2K, waiting for the world to sort of implode. And I feel like we're kind of at that with just these concentric circles of health equity, although it was always there and circling, of just it bubbling up to the top and really exploding. And then structural racism, of course, has been there for many, many years, but really I feel like it's the volcano that's exploding, and they're exploding together. And so we have to look at them together to as Dr. Gourdine talked about, in making sure that it's fair and the community is fair and just and everybody can have access. So I want to talk a little bit about unique challenges that our employees are facing during COVID that will affect their health, right? Because we're really, we're in COVID. It is the elephant in the room. It's, although the numbers are going down drastically and we're doing a good job across the state of Maryland, other states are still struggling, and we're starting to see a second wave, especially in Europe. They're starting to close borders again and close down. So we're preparing for it for the flu season. So I wanted to talk to some of the unique challenges that our employees that will affect their health. Angela, from the HR perspective, we'll start with you.
Yes, thank you. You know, we have focused on the health and safety of our employees from day one. We sent 95% of our employee population are working from home today, and that's been the case since March. And we've really been focusing on making sure hasn't been interrupted service to our members as well. But what we did, the first thing we did after a few months into this was we developed a survey, and we asked employees like how they were doing. We wanted to really get a better understanding of how they were doing with this remote environment. And we got almost 70% respondents, which I think is huge. And I would say to other employers, ask your employees how they're doing, right? Understand their concerns, both short-term and long-term. Most of our employees said they were feeling good about remote work, but they had some specific needs: child care support, elder care support needs. There was challenges just juggling the responsibilities, especially in the beginning and now, of children being at home and remote learning. And so, you know, we continue to address these needs by providing more and more resources for our employees, not just from a physical health standpoint, but I think, like some of our panels have talked about, increasing our resources on the mental and behavioral health side. You know, because we know even if we weren't in a pandemic, we know that mental health and behavioral health is a challenge for many Americans here in this country, and that, you know, children also have a huge effect in times like this. So focusing on providing those resources, you know, CareFirst is pretty unique because we do have behavioral health resources and providers, and we've asked those providers to really provide 24-hour care for our CareFirst associates, so that they don't have to wait and find help and talk to someone, but instead there's 24/7 resources for employees who are really struggling with mental health issues and during this time. The other thing, you know, our employees said they needed some help getting adjusted at home, whether it's chairs or monitors. We've given out 1,500 monitors to date just to help employees with the technical challenges of being outside of their normal work environment. We've also provided stipends, and those stipends that we provided were based on need. So we've given higher monetary stipends to those who may be in lower wage earning roles, and a little bit lower stipends to those who have more resources to maybe provide for a more comfortable remote work environment. So these are just a few things that we've been doing to really address some of the challenges, creating that access to care pretty immediately, really focusing on both physical and the mental care, and all of the technical and challenges just in working from home with a lot of people competing for the same space. I know I have 3 kids competing for my office space today, and I'm trying to keep them quiet in the background. So just, you know, knowing how to deal with that and knowing that it's okay for you to have those interruptions in the day. We've been really intentional about making sure people feel comfortable at home.
Absolutely. Absolutely. I know I'm hearing that we may be having some technical difficulties in audio, so I hope everyone, if you're having any trouble hearing us, please let us know. there was a question in the chat from Dr. Atlas. How do we apply all this to the newer generation, which is not afraid to move jobs? So very good question. The younger generation that is okay actually transitioning. That's a hard question for me, as I've been at my job 20 years, the same agency, different jobs, but same agency. So
from a business aspect, we're a traditional company. Before COVID, we actually were just starting to look at remote working. We actually had an employee who had to move to take care of a family member. So she went from working customer service in our office every day to move to Florida. So and that was about a year ago. And she was our first employee that did that, where technically our customers don't even know that she's in Florida. She jokingly in the middle of winter will send us pictures of her walking outside in 80-degree weather and makes us all feel good about ourselves. But, outside of that, then we had another employee who got engaged to a gentleman up in the Martha's Vineyard area. So now she lives up in Martha's Vineyard and works out of her house there. And so it's very interesting, to see that. And so I think putting it out there, and from a recruitment side I mentioned earlier, is putting the programs out there and say, hey, this is what we're doing. I think, I think a lot of people will say millennials, but I think it's no different than really any younger generation growing up. And you could go back to the 70s and talk about the bell bottoms and say all the older folks there that sat there and would criticize the kids in the bell bottoms. Say, oh, look at those crazy guys in the bell bottoms. Now those folks are all in suits and ties and sitting there and saying the same thing about millennials. So I think it's just a cyclical situation. And I think it's just understanding to say, hey, this is what they want. So how do we present, the different options and opportunities in our organizations to say, this is why we're good. This is why you should stay with us. You're always going to have those few that are going to hop jobs. There's nothing you can do about it. And I think as owners and business leaders, we have to almost embrace that and say, thank you for working really, really hard with us for the last few years. Good luck in your future endeavors. And if we can ever be of service to you, let us help. But I think from a health side of it is, here's our program. Make sure, and then educate them too. Is I think people will sit there and jump jobs just for money a lot of the times, and they won't look at the other aspects of saying, hey, the grass is always greener on the other side. And so if you sit there and say, hey, by the way, are you just, I just want to be a mentor to you. So here's some things to make sure you're checking off. And if you're missing some of those, is that really worth it? And because down the line, that's, becomes important to them, especially as they get older and for a lot of people start a family.
Hey, Tracy, I just wanted to jump in and sort of make a comment, which is sort of like a question, because I'm thinking about my kids who are 27, 26, and 23. And admitting that as part of the older generation now, one of the things that we've learned through COVID, because we had no choice, was that people can be just as productive, if not more, away from a desk. And, there was a time when people wanted to see you sitting at your desk working. Because of COVID, that's not been possible. And I know we've learned in our organization, we were concerned about the productivity, but actually noticed an uptick in that. I don't know if that's something that is attractive to the younger generation, but I do think that embracing sort of new and different and broadened ways of working might be something that is attractive and that we would want to sustain post-COVID.
Michelle, you bring up,
if I could add 2 points.
Go ahead, Cara.
Sorry, just really quickly, 2 points. So one, I think on that is it's interesting because yes, I think we have to give that flexibility and allow that. And I think a lot of companies are thinking about what does their future footprint look like for the office. I think one of the other things that we're also seeing though is that ability to network and to get to know each other is challenging when you're not face to face, and to have those, sort of hallway chats or the pre-chats before a meeting starts. So I think how we think about that going forward, and one of the things that has been really interesting, with COVID, there's been a lot of attention on social isolation, and the generations that are most socially isolated and reporting feelings of loneliness are the elderly and the millennials. So while technology can really help to connect us in some respects, there are other aspects of those connections that you develop with people and friendships that are a little bit harder. The last thing I would just say is something we focused a lot on in my last job in looking at retention in the government is part of the change I think we as managers shouldn't be fearful of that turnover, because sometimes that turnover is good because those individuals may not be in the right place or doing the right job. And so I think we have that tension where we want to keep people, but we also need to let people go and find out what's best for them, because it might actually be best for the company as well.
Yeah, as an organization of over 250 employees, Healthcare Access Maryland went completely virtual on March 16th, which was a panic for many of us because we're outreach workers, we're in the community, we're knocking on doors, we're face to face, and then you told us we couldn't do that and we had to do it telephonically. So it was a transition. We over Zoomed. We had Zoom calls all day long to try and connect. And so I think, we're stepping back from that, but I think we've learned a lot from the technology piece. I think we've learned, telehealth has been brought into the Medicaid space, and for us to go backwards away from telehealth would be really disappointing. And I know that we're really trying to push the community and the Maryland Medicaid to ensure that telehealth stays as a benefit to Medicaid recipients. And so we've learned a lot. We learned it the hard way during a pandemic. So, but from us as an agency, we were just talking today in a staff meeting, an executive team meeting, how hard it will be to go back into the office. Even though there's small wins when you go back into the office, those small conversations before meetings and being able to just pop into somebody's office and seeing people. But, minutes of getting ready in the morning to get out the door and pack your lunch and take your commute. And so lots of different challenges. And then for other people that have transportation issues, taking 4 buses to work. And now maybe they can work from a telework perspective, and that barrier has been removed. So lots of lessons to be learned, I think, from this experience.
Hey, Tracy, can I say one thing about that?
Yes.
I don't think anyone has said it, and if they have, I apologize. But I don't know that the issue is millennials or any generation. We need to, as leaders, we need to change our ways of thinking. I think we have to be more creative. There are some jobs where you have to be, you have to stay or what have you. We're fortunate at Kaiser Permanente that we have a lot of long-term employees, and we're very, very happy about that. But I think this pandemic has taught us that we have to lead and manage in different ways, and we have to be a lot more creative. And so I think we have to test ourselves and to say, can we think of more creative solutions to help people do their job? And we may be surprised at the increased output and outcomes that we'll see. I just wanted to add that.
I love it. I absolutely love it. And it's true. We have to challenge ourselves and not always push it on to our team members to think differently. We did get a question, so I want to make sure we're addressing those timely. So thank you so here's our question. Can anyone speak to ways to solicit information about social challenges their employees may be experiencing, such as housing instability or food insecurity, to understand the supports that they may need to be offered? Really excellent question.
I can speak to that, Tracy. I can start, at least let's start.
Okay.
We have just started here in our region something called the Mid-Atlantic Community Health Network. And it's for our members, and our employees are all members as well. But this is a network of social services that helps people to deal with food insecurities, with housing, with all of those social needs that unfortunately they end up becoming healthcare needs. And so those it's a network that's coordinated throughout the region, and it's actually open to others other than Kaiser Permanente. And it's to access agencies and people who can help people with their social needs. And so we used it a lot. I rolled it out when I was in the Pacific Northwest, and we just rolled it out here. It's a great program, Mid-Atlantic Community Health Network, our community network that has those wraparound services for people.
Yeah, one of the things I would add to that, thank you, is we did ask that question on our survey. And to the person who asked the question, in the chat box, thank you. But that was one of the questions that we asked, because we realized while we have been very fortunate as a business to maintain the employment of the majority of our employees, not all companies have had that same fortune. And so we have employees that may still be working, but their partners, their spouses in the home may have experienced a loss in income, and therefore is, creating a hardship in the home. And so we asked the question, we continue to ask the question, and we continue to leverage resources like our employee network groups to help bring to leadership, what are some of the things that our employees need? What are some of the things that they may be concerned about talking to their leader about, but not as concerned sharing with their peers? So these associate resource groups, employee resource groups have been a huge benefit for us. And we decided to create also a resource page. I know it sounds simple, but as soon as COVID hit, there was so much data that we were pushing out to employees. We needed to organize it. And so we created a resources page. So whether it's resources on care, healthcare, whether it's resources on social issues you may need, children, tutoring for your children, whatever the case may be, just how to just relax. We kind of consolidated it all in one area on our website. We really had to take a hard look at how we were providing data and information to our workforce. And now we're looking at multiple channels, whether it's town halls that are led by the CEO or division leader town halls, or just small social chats. The way you get the information out there is extremely important. And I think we have to be very creative during this time where we're not able to reach out and put our hands on someone and touch someone and really see what the need is. So hopefully that helps.
I think it's important to just ask the question, either through a staff survey, and we embedded it in, we did this actually several years ago in one of our human resources benefit surveys, just because we were trying to get an understanding of where our staff were. We're getting some people taking out loans out of their 401k. We were trying to understand that. So we embedded it into one of our benefit surveys, like how do you like your health insurance benefits, and how do you like the general HR benefits that come with working at HCAM. And we found, and this was pre-COVID, 40% of our staff that completed the survey, and we probably at the time had about 150 employees, and about 60% had completed the survey, 40% reported having trouble making ends meet at the end of the month, and food insecurity was a major issue. And so we know that from the community perspective that food is a barrier. And so these are community health workers and care coordinators that are going out into the community and helping other people navigate food. And our own staff were having the same issue. And so it's one of the areas that we're definitely looking at addressing as an agency. But if we're asking the question, other businesses should also be asking the question. I see you shaking your head, Dr. Gourdine. One of the other questions that I really want to make sure we address is the potential impact on the future of our children and our workforce. I think this is really important. We're kind of skirting across the issue of health equity and the impact of COVID. And, I keep wondering, my child is going to be traumatized completely by COVID, or is she going to, bounce back and be able to be flexible? Maybe there's a silver lining in this, that she can be able to kind of go with the flow kind of deal. But I wanted to ask Dr. Gourdine first, as a pediatrician, what are some of the potential impact on our future of our children and as they grow into the workforce?
No, it's a really good question. And the general answer I will give is that we need to be cognizant of the emotional impact that what we are going through has on us, and assume that it does on them as well. And so there is a need to have regular and open dialogue with your children at the level of their understanding about what's going on, what they're seeing on television, what they're hearing, what they're reading in social media, for example, to allow them an opportunity and a space to be able to process that appropriately and learn from us as parents, first and foremost, how to navigate those difficult situations. All our parents probably told us at one time or another, life is hard. It is. I don't think they meant this hard. This is pretty hard for us as adults as well. But part of sort of ushering children into adulthood is preparing them to handle situations where things don't turn out the way that you would want them to. And so I think, initially the proper response is to have that space for open, regular dialogue. Then, the socialization piece, as someone mentioned earlier with the workforce, is true for our children too. Not being able to go to school, interacting with their teachers on Zoom. What impact is that having on them? Having to learn in a totally different way to adapt and adjust. It's a lot. It's a lot for these kids to deal with. There are resources out there that parents should not hesitate to reach out to if needed for additional counseling, additional tutoring support and help. And for parents who may not be able to financially afford that, then we need to be cognizant of that as well. And as we're thinking about strategies to get us over this hump in terms of COVID and the light that is shown on health equity issues, we also need to think about, in terms of support we were talking about earlier, how we can support, for example, parents who need help with their kids and schooling and tutoring and counseling and so forth. So those are just a few of the things that, putting my pediatrician hat back on, I think are really important for us to remember.
And if I could, Tracy, I think that this is one of the pieces where, when we talk about equity, this is the area that really concerns me, and the sense in picking up on some of the things that Dr. Gourdine was talking about. We have real inequities in our education system, more so probably than anything else. Your zip code determines your education and the opportunities that you have available. And unfortunately, we have kids living in zip codes where they really don't have the opportunity to really thrive educationally. That has implications for their jobs in the future. It has implications for their health in their future, because your income is so much tied to both having coverage or not having coverage, but also the type of job that you have and health outcomes. So we've seen recently people who are talking about this as a potential lost year for kids. And I personally think we will be lucky if it's a lost year and not a potentially lost generation. Because when you look at those older kids who are in high school who may be disengaged and dropping out, they may not come back. And if they do come back, we know that it takes people over a decade before they come back to get that GED. And that's years lost in the impact that they can have. So from an equity standpoint, this is disproportionately affecting Black and brown kids. When we look at who the essential workers are, for everyone sort of on this call now, we're fortunate to be able to kind of work from home and help kids who may need that, if we're helping whatever nephews are supporting kids ourselves. But for a lot of these kids, they don't have parents who are there to be able to help them, because those parents are out working, putting food on the table. Additionally, we know that, in rural communities, broadband is an access and issue. And so a lot of kids getting connected to participate virtually in schooling is a challenge. And that aside, even in our urban areas, we know that parents who have a high school education or less are significantly less likely to have broadband in their homes. So how are people getting connected and participating? And since we aren't doing that face-to-face, we also are not seeing those checks that are happening as much as we need them to on the kids, on the homes, to get them to school lunches and other things to help them thrive. So I hope it's a lost year and not significantly more, but I am fearful that it is going to be much more than just a lost year for these kids.
Yeah, I think you bring such a great point up, and not to go down a rabbit hole, but when you start to go into the child welfare system, at the end of the school year, April, May, June, is when there starts to be an increase in child welfare referrals. And we see that in our foster care work at HCAM, that our volume through those months of April, May, June, we're starting to see new kids entering the foster care system. And we didn't have that this past year, right? Because everybody was home. And so you're missing the school system being able to see those instances of abuse and neglect and refer. Now, unfortunately, we're starting to see that go back up. And so you could say that's a bad thing, but it is actually a good thing because you're starting to remove those children that need to be removed and getting them the care that they need. So you're also seeing that in the child welfare space as well, unfortunately. But I want to flip back to Andy and his thoughts on what employers need to do from an adjustment perspective to address some of these challenges that the working families are going to have to deal or are dealing with and are going to have to continue to deal with.
Yeah, so thank you. You know, at Acme Paper, one of the things that we've done is a lot of flexible hours, especially for those that need to work from home. Just last night, I started getting an email from a coworker at 10 o'clock at night, and as she's, you know, and so we started to chit chat and say, yeah, look, I had to get it done. I needed to run out for something in the middle of the day today, so I just figured I'd pick up that same work, and we're okay with that. I think it's, as an employer, making sure that you have that flexibility. But also setting the rules in place of saying, hey, if something needs to get done, you still got to get it done, and you can't really block it because we need the business to keep moving. But it's no different than, hey, you have a doctor's appointment, you call out and you move forward. So in some aspects, it's better because people can take a doctor's appointment and then pick up those hour and a half of when they were out of the office and just do it from home. So as an employer, there's a benefit to that. The things that we're doing that I think is just connectivity. To me, I think communication and connectivity is the biggest thing. When we started with working from home and working remotely, we still have about 20% of our office staff working in the office because they have critical jobs that we just need some personnel in the office. We have all of our warehouse, we have all of our drivers. So, we all talk, it's interesting, there's a lot of focus on a lot of industries. A lot of people don't remember, our industry working and saying, oh, the state's going to put regulations on essential workers only. And I had to tell all of our employees, say, look, we're an essential company. We supply to the hospitals. We supply to the grocery stores. We supply to the restaurants. Without our products, none of those businesses can do what they need to do to take care of everybody in the world, in the country. And so it's really important that our people understand how important they are to the cycle of what goes on every day. And for us, so going back to working from home, I made it a point very early on. We use Microsoft Teams, and I made it very, very strong point. I could call anyone, hit their extension, it could call their home phone or their cell phone. But I made a point to make sure that whenever I reached out to someone, I did it through Microsoft Teams because I wanted that visual contact. And it was originally it was just like a joke, be like, oh, did you dress to go to work today? But it really was actually a piece of just connecting and almost stopping someone in the middle of the hallway and having that conversation like you would previously, so that you feel connected. And to me, that's one of the biggest things for us is doing that. And because you'll have the vulnerable population. You have anyone who's single right now, who lives by themselves. They're a vulnerable population. Doesn't matter what age they are. They're vulnerable because for them going to work every day was their socialization and it was a break from the norm and the monotony. And so now they're stuck at home in a lot of aspects, and they just stare at a computer all day. And then when they're done with the computer, they probably just stare at the TV or read a book. But there's not that connectivity a lot of the times. I think as COVID has gone on, people have figured out ways to get out and do some things, so that's helped. But I think it's really important that all populations, we're reaching out, we're touching, we're finding alternate ways to touch. And to me, it's visual. It's turn on the webcam and having that conversation.
I'm glad you bring that up, and it's not just single people.
I think
As a parent of two little ones, I will tell you, it's good to talk to an adult.
Yes.
I would add to Andy, and those are great points. I would just add, I've been using two words, like be flexible and pivot. Be flexible and pivot. We didn't get everything right, and we're still not, right? And that's okay. So I remember we sent everyone home in March. Everyone home. Don't come into the office, like shut it down. But then we were creating stress. I think someone mentioned those areas that don't have broadband access to the internet. We have a team of employees in West Virginia that do not have the same files, like we have here in this Maryland area, and we were creating more stress by forcing everyone to be at home. And then employees would say, am I going to be treated differently? I can't get on, I can't get access. So we had to pivot a little bit and say, okay, those who don't have access, you can come back into the office, and with the social distancing and wearing masks, but creating a safe space for those who couldn't, that were working at home was not a viable option. And so we've continued to have to pivot. We put in place a policy, but then if it's not working for everyone, we need to change the policy, or we need to be flexible with our policies. And I would say that's pretty much how we've been trying to manage this. One of the things that we heard early on or this summer, where people were meeting out. They were tired of meetings, just exhausted. And our employees were working more hours than they would have been in the office. There was no commute time to kind of decompress. There was no drive time. And so we decided, okay, we need to create something that establishes some common norm where people can take a break. And so we said, you know what, no meetings between 12 and 1 daily. Something as simple as that has created, oh my gosh, now it's like I can go out and walk, I can attend to my kids, I can do whatever I want to do between 12 and 1, maybe just think and work on some personal things without being tied up in a meeting. So, we've been rolling things out, pulling back, adjusting back and forth. Just know that everyone's situation is slightly different, and you have to be okay with kind of adjusting, listen to what employees are saying, what's working and what's not working, and really just changing when you need to, and that's okay.
Yeah, Angela, you bring up a good point of pivot. And when we first went out on telework, we had 200 employees, many that were parents, and we were going in like these 2-week buckets. And of course we didn't know what was going on with COVID, and every 2 weeks we were extending it, and then it was a month and we'd extend it. And we started to get the anxiety that was building up from our staff like 5 days before. Are we going back to work? Are we going back into the office? And so finally I just said, indefinitely we are teleworking status unless you hear differently. And I did a lot of education to our staff. I did What's Up Wednesdays that went out once a week from myself as a CEO to say, this is what's going on. We're working on doing X, Y, and Z. This is what we're hearing about COVID, and just some education and being connected. But we removed that timeline, and I think people exhaled a little bit because they were so worried about their kids and daycare and summer camp. And so we've removed that, and it's still telework status indefinitely until that has changed. But we did get a question, and I do want to make sure, Andy, did you have something to say?
So you mentioned you do the What's Up Wednesdays. So one of the things I think it's also important to do, especially for private businesses, is that a lot of the employees, they're wondering, is the business doing well? Are we going to have a job coming out of this? And so one of the things that we've done at Acme is my father, who's our CEO, he'll send an email out, a video email that he sends from his dining room of just update of the company. Hey, this is what we're doing as a company. We're, here's where sales are compared this year compared to last year. Here's where sales are compared to other people in our industry throughout the country who are part of an organization we're part of, so that people can understand, say, hey, you know what, there's good things happening here for us, that you don't have to worry that we're going to have mass furloughs or layoffs or things like that. So you're safe. And I think going back to health equity, I think that's a really important thing, so people don't have to sit there and worry. So it's one less thing that they need to worry about. And then at the same time, if they need extra help, they know they can ask. Because I think a lot of people are afraid to ask, because if they ask, they sit there and say, well, if I ask, could someone take it the wrong way and be a negative rather than a positive? So I think, it's about being open. And that really came from my brothers and myself, is really talking to my father and his generation and saying, hey, we really need to be just over communicating right now. And I talk about communication. That's really everything in my world of what I do. I just believe communication is key to everything we do. If you tell people what's going on and you don't surprise them, it takes away some of the mental stresses of what we deal with on a daily basis. And you talk about the younger generations too. And I just think with my 5-year-old, listening to him talk about coronavirus and some of the things yesterday, we told him that we couldn't go to the Ravens game, on Monday night. He wasn't going to go. He's 5 years old. He wouldn't go to a Monday night football game anyway. But he said because of the coronavirus, which I'm like sitting there and saying, one, where do you get that? Two, it's interesting to see some of the things that kids are picking up and doing. So it's it's a very interesting time for all of us, I think.
Kids are very perceptive. Mine's always like, when Corona's over. I'm like, okay, when Corona's over. This morning it was, we're going to Hawaii. So I said, Corona's over, we're going to Hawaii. But I do want to make sure we get to this question from one of our panelists, Rick Drager. How do you see a path forward for really articulating this broad issue of health equity and the cost or impact to people and the healthcare system as a whole? Is it really best for today to focus on this on a small community or company basis? Example, start tactical and work strategic over time. So that's a big question. Anyone want to jump in?
I can start.
Okay.
Yeah, I'll start. I think it is a big question. And I think that right now we are in a moment where clearly because of COVID and the social unrest in our country, this is getting more attention than it has in the many years that I've been focusing on health equity, which is great. We also are in a hyper politicized moment at this time. And I think that it is not something to be taken for granted that everyone is on board or agrees that health equity is a big issue that we need to deal with. So to be a little bit pragmatic and practical about it, I would focus on where you can get those small wins in those communities. There are efforts. One of the things that we talk about is the socio-ecological model that we all live in. And so that's policy, it's our organizations, community, state, on down to the nonprofits and the individuals and families that they live and are helping. And at every level, we need to be thinking about how do we address health equity, because everybody has a role at every level. And it's not going to be simply something that Congress can fix or something that philanthropy can fix or something that nonprofits can fix or business. It's all of us working together. So in those small communities where you have that leadership and the buy-in, I would say start there, helping people to see how it affects their daily lives, starting in some of those small pieces where you can get some of those easy wins, because this is not something that arose overnight, and it's not going to be something that we're going to fix in a 30, 60, or 90-day plan. So building on those easy wins, working together. For some people who are coming into this space, this may be the first time that they've really looked at and engaged in health equity, and so they're trying to figure out the landscape. So if that is, sort of your organization, reach out and find out who's in the community, who's the community leaders, who has those connections. We talked today about trusted sources for information. Those are so important, and if you're trying to tackle these issues, you've got to have the trust of the community and the people that you're trying to work with. So I would engage them as well in those solutions, because one of the things that I have found over time is that, you can sit in our offices and we're like, what the problem is? And then you go out and you talk to the community and they're like, no, that's not the problem. And not only is that not the problem, if you implement that solution, here are the 10 reasons why it's going to fail or be problematic. So really engage and build those bridges. And I think a lot of those bridges have started because people have pivoted to respond to COVID. So people who've come together to get PPE into the communities, to help the kids, to put up food pantries or other things, those connections are there. Build on those and start to tackle some of those health equity issues.
So Cara, a great transition to the next question, which I think is kind of being fed by Rick's original one. One or two takeaways that you would give the audience, especially from an advocacy perspective. And we can go round robin on that, but I think you're really touching on those. What are those takeaways and those little pieces of advocacy that we can do now, outside of voting in November, but and making sure that your vote counts?
Yeah, I think, so one, I think each of us sits in different places and we all have a role to play. So one of the things that, we're talking about business and what business can do in equity. And I think, we're not necessarily looking for businesses to start health programs, although if they want to, that's great. But, business has a bully pulpit, and all of us have a bully pulpit in terms of the things that we talk about or focus our attention on or give our personal capital to. So if you are interested in engaging that space, think about how to reach out and leverage that opportunity. There are also ways to engage our civic leaders. So it is clearly an election year, but we're not just focusing at the national level. State and local policies drive so much of what happens in communities. And I think, working with those local leaders, being mayor, county executives, whomever that may be, to help support and push these issues forward, thinking about things that could be something as small as having a park in some of the communities that don't have those, to give that outdoor space for families, kids, whomever, to engage and to exercise. That was one of the programs that I thought was really great, was a school, a nonprofit down in North Carolina realized that a lot of schools didn't have tracks or outdoor space to run. And they just put quarter-mile trails around the schools, and it led to a decrease in obesity among the kids. It also led to improvements in their test scores, and to some of the kids who had, one of the stories they tell is this young girl who had cerebral palsy who was walking with a walker, and by the end of the year, after these 15 minutes a day of just getting out and exercise, she was able to walk without the walker. So those small wins that can have really big impacts are one of the things. And I think we've talked as well about thinking about people at different levels. So looking across your organization and thinking about everyone from the lowest, paid employee to the highest paid employee, and what are their needs, and how do you give them what they need to be able to succeed. So those are a couple of the things, and looking at some of the social investments and where people are going. But I would just say the journey of 1,000 miles begins with a single step, and hopefully we can just take that single step now and start to move in a positive direction.
Wonderful. Thank you, Cara. Dr. Gourdine?
Yeah, Tracy, I'd like to just add to that, that in addition, one of the things that has been difficult to do, but I think based on the tipping point that we find ourselves in now that Cara explained so well, it would be important for our organizations, our businesses, if we are so inclined, to begin to allow safe spaces for people to have conversations about race. It is a touchy subject. It is a subject that often is emotionally charged. But I think that allowing individuals to share their experiences, the stressors that they might encounter from those experiences, which directly contribute to health equity, is very important. Colleagues that I know from across the country who work in healthcare and other settings have begun to have those. And it literally is just, let's just talk. There is no expectation. There is no intention of making anybody feel bad or feel guilty. There's no finger pointing, but it is an opportunity to be able to allow individuals who may not have felt comfortable sharing their lived experiences in the past to do so. And so you can imagine that certainly from a psychological perspective, that is valuable, and from a physical health perspective, that is valuable as well. So I just wanted to add that to the great list that Cara provided.
Yeah, we did that with an HCAM. All the months blend together, but I think it was in August where we just had a facilitated discussion. We had breakouts with the team members, and it really was around race. And obviously we're a big team, so we broke it out into, and it was on Zoom. And so, if you were feeling uncomfortable, you could turn your camera off, you could listen. And we, had really good conversations about what it meant to be an ally, what it meant to have white privilege, what other people were dealing with because of COVID that, maybe their colleagues or coworkers weren't thinking about. So we just had these facilitated discussions, and we'll continue to do so at HCAM. And getting these conversations out into the community in our speaker series, I foresee something in 2021 coming on specifically on race. It's coming.
Great.
Yeah, I'd love to help you on that one. We are about to launch our speaker series on diversity, equity, and inclusion. And we've been doing quite a bit of training this year on DEI for obvious reasons. But we said, you know what, it's time to dig a little deeper in these conversations. So we've reached out to kind of your non-traditional employees, if you will, not those that are working in the DEI space or in the HR department, but outside of those departments, and ask them about their experiences with diversity, equity, inclusion, and belonging. And so we've asked them a series of questions. It's a very intimate, I would say, speaker series. And I think our employer population is really gonna enjoy it, because we are asking some of the non-traditional players to get involved in this conversation, not just those who are in our employee network groups or our affinity groups. And it's just been a pleasure to see our employees really share their personal stories. We also, we did this one game called Factuality. And it's, I hate to say that I forgot the person who owns the rights to this game, but it's where we speak about our individual experiences, personal experiences with race and equity. And one woman in the room talked about how after a particular surgery, she did not receive pain meds into any degree that some of her, and this was a woman of color, this was a Black woman in the room, than some of her colleagues had. And you could see how awful people really felt in the room, that this is someone that they knew. They had a similar surgery, and their experience around their experience in health and in this particular procedure that they had both received were so different. Just because of the color of their skin. And we know there's a lot of data out there that shows that people of color don't typically get the same level of support when it comes to pain medicine, and as their counterparts that are white, and that this individual was in so much pain, and how her colleagues really did not know that this was an experience that they would have had. And so having those intimate and personal conversations and taking it from that person out there that no one actually knows to someone right in the room who has experienced inequity or discrimination, I think is the way to go. And it is a journey. It's not one and done kind of conversation, one and done training. It involves multiple constituents, not just employees, but leaders, managers, the board. Your board of directors should also be involved in these conversations, and taking it to the community, I think, as well.
Great, Angela. I look forward to having that conversation with you about your speaker series as well. Andy, any last one or two takeaways from your perspective?
I think from go back. I keep saying communication, but I think is making sure you provide your employees with the things that they need. I think earlier on someone mentioned that supplying I think it was you, Angela, that talked about supplying computers and laptops and things like that, and monitors to your employees so that they could work from home and do their job in a good manner. For us, some of the things, we're lucky in that we are suppliers of Purell hand sanitizer, of disinfectant wipes, and things that are critical, toilet paper, right? So when a lot of those items were hard to get, even cases of bottled water, we made sure our employees had the access to it. So it's also, even if you're not a supplier of it, but you have access to being able to get somebody, some bottles of hand sanitizer, just so that they can feel comfortable walking around, going to the grocery store and having that hand sanitizer to be able to, after you're touching the shopping cart, when you get back in your car, you can sanitize your hands and feel comfortable that you don't have to worry about potential cross-contamination of anything. So I think it's really talking to your employees, and I think Angela, you said it, and I think Cara, you may have even mentioned it too, with regard and just understanding what people need and doing the little things. And I think just like the question we had earlier, it's not about doing the big. In business, it's really hard to do the big, but I think as business leaders, it's find those little pieces, and they make such big impacts, and you can take a little bit at a time, and that's really, honestly, it's Rome wasn't built in a day, right? So that's kind of where I'll leave it.
Thank you, Andy. Ruth, any other takeaways on your end?
Yes, I have three, and I will say I'll take them in order. I don't know that they're necessarily in order of importance. They're all important, I think. Supporting families with children. I really believe, and I know that when we think about parents who are home supporting children, whether they're single, whether they have a partner, whatever, we need to do that, because I was touched by what Cara said about not only maybe not just losing a year, but losing a generation. We need to guard against that, and we need to support our children and their mental and social health as well as their parents. Number two is equity. We have got to have these conversations, and the only thing, not only conversations, but take actions. And so, not to repeat what others have said, but this past summer we had listening sessions across our company, and it was just very emotional to hear some of the feedback from people, things that are going on in their lives, not just related to work, but just how they have experienced racism. And so now we're moving into, for our employees, an action session this fall, actions, human-centered design actions. And so we really, and our president, our CEO and chairman of our company had a big listening session with all employees. And it just makes you emotional to hear some of the things that people go through. And then I would say the third thing is social health. And it rolls up with people who have children, with the experiences of racism, and all of the stressors, including COVID, that have converged in this year of 2020 to cause just incredible stress. So we need to pay attention to mental health, social health, and make sure people have the things around them that are going to help them live their best lives as we try to get through this time that we don't know when it's going to end, but we know it will end at some point. We want to come out on the other side healthy as we can, and be a very positive community with a positive ecosystem.
Thank you, Ruth. You handed me that so nicely about mental health to transition to save the date for our October 6th speaker series, which will be on trauma, a personal story by Tonya Kane, who is from Maryland and now an international speaker on her experience of trauma. And then we'll also be talking about mental health. So we're really excited, and we'll make sure everybody that attended today got a save the date and actually a link to register for our October event. I just want to throw it back out to the attendees that are still with us. Thank you for those that are still hanging on. Questions, these are a great time to do Q&A. Any last questions for the panel? To go ahead and either put them in the chat or in the Q&A box. And I wanted to thank everyone, Angela, Ruth, Andy, Michelle, and Cara, for joining us today and having these really hard conversations. And I think if this is just the start to start to have these conversations and to challenge those on the call to go back and take this conversation back to your businesses, to your leaders, as part of, an advocacy role. Again, going back to Ruth Bader Ginsburg, if she didn't challenge some of the things that she challenged and asked the questions, we wouldn't be here today as, but a very strong woman panel. So we want to encourage you to take these conversations back to your businesses, back to your colleagues and your coworkers, and start to have these hard health equity conversations within your own business. We encourage you to do that. Again, thank you to our sponsors, Maryland Hospital Association, Tri-Bridge Partners, CareFirst BlueShield, and their partnership with Greater Baltimore Committee. Thank you everyone so much for attending today. And I think we're going to wrap up. And we'll make sure that you get information around our October 6th speaker series, and that will be a morning event.
Thank you.
Thank you.
Thank you.
Thank you, everybody.
Thank you, everyone.
Thank you for joining.